I'm Larry Farver, and let's queer up health. David Furnish warns political rollbacks threaten decades of progress in global HIV prevention. David Furnish is warning that political decisions are putting decades of progress against HIV and AIDS at risk. In an Independent Voices comment piece, the chair of the Elton John AIDS Foundation said criminalization and funding cuts targeting LGBTQ+ organizations are weakening community-led HIV prevention and care efforts. Furnish wrote, quote, "I am writing this because that legacy is now at risk. The threat isn't the virus, it's politics," end quote. He also talked about long-acting PrEP options, including lenacapavir, sorry about that. He pointed to setbacks and HIV prevention, citing a 41% reduction in PrEP initiation through PEPFAR and a 4.7 million fewer HIV tests in 2025 compared to 2024. He linked today's HIV response to AIDS activism led by ACT UP and warned that growing criminalization and cuts to queer groups could undermine public health efforts worldwide. Quote, "Equality is not separate from public health. It is public health," end quote. Well, I applaud David Furnish and his husband's efforts through the Elton John.
I was going to say,
yes.
For those who are uninitiated, David Furnish is the husband of Sir Elton John.
Yes.
And the truth is that and he is absolutely correct. Setbacks in LGBTQ rights inevitably impact AIDS healthcare, and it is not because that. And I just want to set this straight. Most HIV people, most people who are suffering from HIV are not LGBTQ. The problem is that, one, criminalization of LGBTQ people, especially in some of them they attempt to do right here in the United States. Some of them are doing their work in Africa, in other third world countries. We are talking about people or developing countries, pardon me. The stigma of being LGBTQ is enough to drive people away from public health services. Mm-hmm. And in countries where they are literally criminalizing identifying as LGBTQ, I mean, there's Uganda, Ghana, and other African countries, for example, which are heavily pushed by American evangelical groups in order to stigmatize LGBTQ people. You are basically setting back public health by driving a significant portion of people who could have had their lives saved and away from them, and that doesn't mean that they stop having sex. That just means that they are no longer seeking public health treatment. Moreover, in the same vein, when these organizations try to essentially label HIV/AIDS as just a gay disease, people are going to basically avoid treatment because on one hand, the government is literally saying that you just call yourself gay, you're going to jail, and then calling the virus a gay disease means that people are not going to go seek it, even if you're straight. Even if you're straight, you're never going to seek testing, you're going to seek treatment, because just walking into a testing center is probably enough to label yourself. Mm-hmm. Basically the equivalent of draping a rainbow flag over your shoulder and put a giant target on your back.
Yeah, but and we certainly need to make sure we vote in this November's election and anytime we can, because it's so important, and we need to work as a community and be unified and not just be part of the alphabet, the entire alphabet, including our allies. I go in and I'm a regular thrifter, so you'll see me out of the closet in both Fort Lauderdale and Wilton Manors. But there are people across the spectrum. Not everyone that goes there for consultation for either testing for HIV or STIs is necessarily gay.
It is open. AHF is absolutely not. AHF do not discriminate based on your sexual orientation. They make testing for all. The whole point is that the more people get tested, the better we can address the public health crisis.
Yes.
The more we stigmatize, the more we try to force a portion of the population away from public health services, the more likely the virus will spread. The same way that people who are resistant to vaccines are more likely to spread to spread other type of virus, from measles to COVID, outward to other
Absolutely.
people. And virus don't discriminate because of whatever identity you choose. Virus are virus. They don't choose who to infect. So be careful, get tested. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight. Look,